Halitosis, or otherwise known as bad breath, I think it's a big problem. Especially as a dentist, you can understand why I would be affected by halitosis or patients having halitosis. But it's a question I receive a lot. It's a spouse saying, my wife thinks my breath smells bad. She tells me, what can I do? It's a very common thing. So it's important, number one, to understand what the bad breath is coming from. A lot of patients say, well, I brush my teeth. Why do I still have this bad odor in my mouth? Well, you have to brush your tongue because the bacteria lives on the tongue. You have to floss your teeth because you can have food particles stuck in between the teeth. Sometimes you have some gum issues that you don't realize, and there could be bacteria and tartar underneath the gums, which is causing this issue. So our office is unique in that we utilize something called a halitometer, and what this does is it measures the bacterial count in your mouth, more specifically the sulfur containing bacteria in your mouth, which is responsible for about 98% of the halitosis that is causing the bad breath. So what the halitometer does is it measures the sulfur content, and based on certain readings we can determine basically how bad your breath is, because it is a subjective, or it can be a subjective type of thing, but the halitometer makes it more of an objective reading, and we treat it, and we can actually measure, when you came in you had this much sulfur containing compound, and now that we've been treating you, you've gone down to this. So it's a nice way to be able to measure. The number one way to reduce halitosis is oral hygiene, by far.